Hey everybody, today we're going to be talking about healthy policies. And I know you might not be thinking about policy. How does that have to do with self-care? It has everything to do with self-care. And in this group, we talk about how if you're going to make mental health healthier, you have to talk about people, partnerships, and policies. So for the month of June, because the legislative session just got done, we're going to be talking about some of the policy changes that are coming down this month and thinking about how they impact us and how they can impact the people that we serve. And so the first one we're going to talk about is the big tax bill. The big tax bill had a huge component in it of mental health. It had a lot of other topics in it, including inheritance tax. There were some pieces on estate taxes. There's pieces on just lots of different things, income tax. But we are specifically going to be focused on the big section of the bill about mental health and what it means for us. So what mental health is going to be doing is shifting the funding mechanism for our state. Now, for some of you that are new to the conversation, let me just give you a background information about this. So in Iowa, mental health funding has been funded on property taxes. We were the only state in the country funded on property taxes. And property taxes in our state got frozen in 1996. And so there was a cap on how much money each county could spend, and the levy was also capped, meaning how much per person or per $100,000 of property could be spent on mental health. And so even though we've done all of these big policy changes through the years for things like children's systems and core services and complex needs, which we're going to talk more about some of those later in the month, we never really got the funding mechanism fixed. And after that many years, 25 years, we can tell you that there was not going to be a way to fix the funding mechanism, keeping this on property taxes. There was just no way that was ever going to get fixed. And so the state needed to do a different type of funding mechanism in order to get more funds and a more stable funding mechanism for mental health. This bill does that. So what this bill does is it creates a fund separate from the general fund that's protected monies where the funding is going to come from the state. Now that is still tax dollars paying for mental health, but it's different type of tax dollars. It could be sales tax, it could be part of income tax, it could be part of any other kind of taxes that goes into the state. So anytime we pay money to the state, you are going to have taxes that pays for services. So that means everybody that pays taxes will be part of the funding mechanism for mental health. That's very different than where we used to be. Before, everybody who owned property funded all mental health services in regions. But if you didn't own property, you had no skin in that game. And so this is going to make that more equitable for who is paying into the system. Second, it's going to come from a state source so that the state is going to send that money to regions per capita. That means for each person. So let's think about this. The funding got locked for property taxes back in 1996. And certain counties in our state have grown a lot since 1996. And you can probably think of the top 10 without thinking too hard, right? Anywhere where their bigger cities are the growing counties. So you have your Dallas County, which has Waukee and surrounding metro areas. You have Polk County that has grown since the beginning of this. We also have counties over like in Woodbury and down in Council Bluffs and in Lynn County and Johnson County where Cedar Rapids and Iowa City are, and up in Waterloo and over on the other border with Quad Cities. And so as those areas got bigger, the money was locked at how much they could spend on property taxes. So the levy just got lower and lower and lower, meaning that you could spend less per person because you couldn't go over that cap. And so now, for the very first time, we're going to have funding coming into those growing populations per capita. And that's really exciting because the areas that have grown can finally get funding for every person that has grown since 1996. And we haven't had that. And so that's a really exciting piece. The second piece of what they did was they talked about creating an incentive pool. So this is going to be where the state's going to work now with regions on what they're calling some performance-based contracts. So regions now, and you may not know this, but in the code back in 2011, 2012, we put what services should be available to people in the code. And so you should be able to expect certain levels of services no matter where you live across the state. And it had minutes and distance parameters. So somebody living somewhere should have, outpatient services within so many miles and so many minutes of their home. And that is true about inpatient, that's true about the MHI situation, that's true about every service. Now, regions have not been held to those standards. The state has not had any kind of a stick, any kind of mechanism to keep regions providing those services at the requirements across the state. Now that the state will have control of that money, regions will need to actually do what they're supposed to do. And those regions that do better will get better funding. They will be able to enter this incentive pool to actually be able to get additional dollars. That incentive pool will also help some of the regions that are going to be short as we transition to per capita funding, when we move away from property tax to per capita. And that's going to take a little bit of time. So we've got an extra pool of dollars there. A couple extra things that happened in this tax bill, and some of you may or may not care about these things, but they play a role, is that you have to spend down what they're calling ending balances. Now, property taxes in our state are levied by county. And regions, when they started working together, some of them pooled their money and some of them didn't. And they had these balances where they had collected tax dollars in their area, but then they didn't spend them for mental health services. And those tax dollars could only be spent for mental health. And in some areas, some regions, some counties, the balance at the end just got bigger and bigger and bigger. That was like a big savings account. But the only thing you could spend the money for is mental health. And those ending balances make our balance sheet look lopsided. At any given time, it looks like we could have $75 to $90 million sitting in the bank, but it wasn't necessarily where you had people. So places like Polk County doesn't have any ending balance, and they've been way bigger population-wise than they've had money for decades. And so you couldn't move the money from one place to the other. And so this bill gets rid of that. This means that you have to spend down those ending balances in order to get those per capita payments from the state. And that's going to start equalizing the system, where you finally have an amount in the system where it goes where the people go, but also doesn't just keep taking property tax dollars from people and leaving it in bank accounts where it's not actually doing anything. So that incentive pool, monies are going to flow into that based on if you have those ending balances or not. And it's going to incentivize people to grow the services that we've told them to grow. And again, we put core services in the code back in 2011 and 2012. We put complex needs in the code, which is more services like ACT teams and access centers and crisis services, subacute, IRF homes. All of that happened around 2016. And then children's mental health. We said we wanted crisis services in a children's system in 2018. All of that's been put in the code, and now we're going to have funding to be able to actually incentivize regions to develop what they're supposed to develop. And so over 5 years, those per capita payments increase, and so that we'll be fully funded across the state. And that's really exciting. The other thing that happened in this bill is they put in a growth mechanism. So if you think about school aid funding, I don't know how much you know about how schools are funded, but every year they automatically assume they get a % increase. And people argue with the state every year about how much of an increase they get. Mental health has never had that. We have had no growth. We have had locked levies since 1996. Every so often the state would put more dollars in. The state bought out Medicaid that helped that some along the way, but there's not been any kind of growth. Now there's actually going to be a growth mechanism where people can actually count over time what monies are going to come in. And so then regions can start to plan and to start to decide, if we start building these services, that for sure we'll have money next year. And that's always been the challenge. It's been that who wanted to build services not knowing if next year you might not have the funding to pay for it. And so because of that, super important that we now have a growth mechanism. And it may not be right because we don't have everything built out. So when people are concerned about how much growth was in the bill, well, you don't have all those complex needs services built. We don't have all those children's services built. So how do you know how much growth you need? So it's a place to start.